Hi, I'm Holly Smith, and I'll be presenting on the asymmetric tonic neck reflex. What is the ATNR? ATNR is also known as the Fenter's reflex. It's a primitive reflex in infants that helps them coordinate their movements. It helps them develop motor skills and explore their environment, prepare for crawling and walking, but they usually lose this integrated by age 6 or 7 months. So some problems that can arise if the ATNR is retained is difficulty turning your head and neck, poor coordination of arms and legs, difficulty crossing midlines with the eyes or hands, and visual perception difficulties as well. You can have delayed hand-eye coordination, difficulty with fine motor skills such as writing or holding a pencil. You can have a tendency to arch back or hunch forward, and there's usually delayed motor milestones as well. So that can be crawling, walking. Some treatments for retained ATNR. You have physical therapy exercises. This is an example of an integrated reflex, and this is a retained reflex. The child is unable to hold both of his arms out straight because the reflex has been retained. So occupational therapy often involves sensory integration activities, which another slide will cover those. Sometimes medications can be used to help treatment along. So this is one of the exercises that might be used in physical therapy or occupational therapy. You see, this is an adult doing the lizard exercise. This is a child doing it. It involves some structured repetitive movement that stimulates the neural pathways that are required for integration of this reflex. It involves repeating turning your head and extending or flexing your limbs. This helps to absorb the ATNR reflex into more complex voluntary motor patterns that are necessary for those normal milestones like walking and crawling. Once this is integrated, it can improve hand-eye coordination, midline crossing, and auditory processing. Sometimes the reflex can be retained as late as age 10. I've seen that in the clinic once or twice. So a couple of things that I've watched in the clinic. The therapist will play catch with the client. Sometimes they'll miss the target, go slightly to the right or left so that the client has to reach for it. You can let the ball bounce before it gets to them so that it's a little bit easier for them to catch and they have more time. They also will practice catching with both hands so that they can work both sides of their body. And crawling is another one. This would be especially for younger kids. Moving your limbs while you're turning your head, that will help integrate the ATNR. So the therapist can hide toys so that they have to look around. They could also have them reach under their other arm to grab objects, which requires them to cross the midline, and that's also helping integrate. And these are my references. Thank you.